Thank you very much. Let me begin the questioning and give the mic over to Senator Cassidy, and we'll go around the table. As I mentioned earlier, in my state, in our largest hospital, we have seen a huge expenditure of $125 million for traveling nurses at a time when we have more young people who want to become nurses but can't accommodate them in our nursing schools. Dr. Herbert, is that in fact just a Vermont problem, or is that a Maine problem? Is that a national problem?
Senator Sanders, it's very much a national problem. The traveling nurse situation that you described, I mean, you're exactly right. We're seeing the exact same thing in Maine. There's a number of reasons for it, but I think what you're hearing from the panel today, there's consistency in terms of the nurse educator problem, but there's also, hospitals are really strapped with the workload issues that I described earlier in terms of reimbursements, and so it's complicated. But the clinical training sites like hospitals need support to be able to accommodate more trainees, which will help with the problem.
Okay. Dr. Zanton, how are we going to give me some specific ideas as to how we get more nurse educators out there so we can accommodate the number of young people who want to become nurses?
If we could increase all the programs through HRSA, like the Nurse Corps, that would be a really concrete suggestion. Currently, almost none of our students are able to get the Nurse Corps because we have a master's program. So I think, solving all the problems that we talked about and having more simulation, passing the FAN Act would be ways of quickly trying to increase the nurse faculty abilities of this country.
Okay. Dr. Hildreth, it is widely recognized, not debated, that African Americans, Latinos, and Native Americans are underrepresented in the healthcare profession. No one debates that. What is the impact of that? People say, so what's the difference? So you have a white doctor, a black doctor, who cares? Is there a difference? What is the difference?
Thank you, Senator Sanders. The data are very clear, as my colleague referenced earlier, that when the healthcare workforce reflects the population they care for, outcomes are better. That's not to say that a white doctor can't provide great care to a black patient. That happens every single day in our country, and vice versa. But when the provider team looks like the population they're caring for, the outcomes are better. That's been demonstrated over and over again. That's what we lose by not having a diverse workforce, the best outcomes for communities.
Thanks very much. Dr. Swanee, you talked about large areas of Louisiana, in fact, all over this country, not having enough physicians, nurses, et cetera. It's a little bit outside of the scope of this hearing, although I'm going to get back to it because we have jurisdiction over the Community Health Center program. Do you think that expanding community health centers to rural areas in America would make a lot of sense?
Thank you for that question, Senator Sanders. I do. I think they're important. Osher is starting 13 community health centers throughout Louisiana. They serve an important need.
Are these federally qualified community health centers?
These are our own. We're going outside the federally health qualified centers. So we partner with federally health qualified centers, and we're starting our own community health centers too. We're meeting all the federally health qualified center guidelines, but it was quicker to get there into our communities to serve.
Would it be advantageous if they were FQHCs? Would it work well for you or not?
It would be advantageous if we could work with the government to make health centers like Osher be able to start these federally health qualified centers and spread them more quickly.
Good. Let me go back to Dr. Herbert. One of the areas that we do have jurisdiction over, and I'm very strongly in support of teaching health centers GME. And that is an opportunity to get residents out of teaching hospitals and into primary healthcare facilities. Perhaps you and Dr. Hildreth can say a word about that. Is that a good idea to expand those programs?
That's a very good idea. And because of the caps on GME funding from the federal government, states have actually stepped in and done some creative things. I mean, for example, the state of Georgia has done that. We're now working with colleagues in Maine to establish, trying to get some legislation through the state of Maine to actually directly fund GME through partnerships based in community health community hospitals, but in partnerships with the teaching hospitals. So there's some creative things that can be done. It can be done much more much more quickly if the CMS rules were changed in the way they fund GME, but there's other innovative ways of doing it. But we absolutely need more GME. This is critical not only for primary care, but for some specialty care as well. Senator Sanders and I Senator Collins and I apologize, we're talking this morning about obstetrics and the closure of obstetric units in rural hospitals and community hospitals. And again, GME is really the key to addressing these various issues.
Dr. Hildreth, do you agree, or?
I definitely agree, and as you referenced earlier, Senator Sanders, we want to make healthcare happen in the lowest cost setting possible, and that's certainly outpatient setting for primary care. So I definitely agree that more GME in those settings would be great.
Good.
Thank you.
Thank you very much. What happens when you don't go to the doctor and you're sick? You get sicker. And maybe you end up in an emergency room where the cost of primary care is 10 times or 8 times more than it is if you walked into a community health center. And if you can't afford prescription drugs, you get sicker, and you may end up in the hospital at a cost of $100,000. So what we are talking today about is two things. My own personal view, not shared by everybody on this dais, is that healthcare is a human right, and that we should emulate what goes on around the rest of the world and guarantee healthcare to all people. I don't have the votes to do that. But I do hope, and by the way, I think we are making progress, in a bipartisan way, at least saying, whether you're in rural Indiana or rural Vermont or Louisiana, or where you may be, New Hampshire, that you do have the right to get into a doctor's office and save the healthcare system substantial sums of money. You know, it's a funny thing. We had a hearing a couple of weeks ago on the crisis in the healthcare workforce. And it turns out that there was strong bipartisan support. Nobody denied the fact that we need more doctors and nurses and dentists and mental health practitioners and pharmacists. We all understood that. And ironically enough, I mean, to talk about nonpartisanship, the witness that Senator Casey brought was, I thought, brilliant, talking about what was going on in Louisiana, doing extraordinary work. Could have been
not Casey.
Oh, I'm sorry. I'm sorry. Casey was good too. But you were better.
Yep. All the Irish guys look alike.
There you go. But the witness that Senator Cassidy brought from Louisiana was, I thought, just great. Could have been our witness. We brought Dr. James Herbert from New England University. Turns out I first met Dr. Herbert through Susan Collins. That was our witness. 2 years ago was her witness. All right, why is that? Because I think we all understand we got a crisis, we've got to work together. So our challenge right now is to do the right thing for the American people and say that when you get sick, there will be a medical home for you to go to. And our other job right now is to say that in a healthcare system which spends $13,000 per person, that's an insane amount of money. That is double what any other major country does. That we understand when we invest in primary health care, we are going to save the system money. So that's the struggle we have, and I am determined to do everything I can in a bipartisan way to make sure that we put together the kind of primary health care system the American people want us to do. So with that, let me introduce Senator, what's the last name, Casey? Cassidy?
Collins.
Collins, all right. Now we'll begin with questioning. I'll start, and Senator Cassidy will follow, and then we'll go around the table. Panelists, let me read a quote which I think speaks to the bipartisan support the community centers have always had. This is what George W. Bush, President Bush, said in 2004, and I quote, "I think it's a wise use of taxpayer money to expand and increase the number of community health centers all across America. As a matter of fact, the goal I've set is every poor county in America has a community health center. It's much better if folks who need help get help at the community health center than in an emergency room or a local hospital. Not only do taxpayers save money, it's a more compassionate way to help people, end of quote. That is George W. Bush, 2004. Bush talked about expanding health centers to every low-income community in America. Today, we have medical deserts for almost 100 million Americans. Was Bush right in his desire to expand community health centers all across this country? Amanda, you want to take a shot at that?
Certainly. I appreciate you calling out the long history of bipartisan support for health centers, and I think he is right. I think health centers are poised to step up and do everything that they can to care for as many people as are in need. Our proposal focuses on reaching 40 million patients, but certainly I think health centers are up to the task. And I think, to be honest, Senator and members of the committee, it really will come down to the investment that's made, enabling them to do so. If we're talking about caring for 100 million Americans, which I think health centers could certainly scale to do with the appropriate investment, we would need to scale our proposal. It would be considerably more over year to year. But there has never been a time where I have seen health centers not meet the task. And I think where we are today, it has everything to do with the investment that is made to enable them.
Okay. Thanks very much. Let me ask Ms. Veer, in your testimony, you talked about keeping people out of the expensive emergency room care and getting them to a community health center. We're doing a little bit of that in Vermont as well. Is it your understanding that all across this country, people who do not have a medical home end up in emergency rooms and much more expensive care than would otherwise be provided through a community health center? Say a word about saving money in that regard.
Absolutely, Senator. I believe the lack of a primary care medical home has that impact. And I think it's a multi-generational behavior that we see, that over generations, that's what people have done. And as a result of that, not only are the hospitals saddled with incredible bad debt, I mentioned that one of our health center sites is located next to an emergency room. And we originally hoped that we would get direct referrals from that emergency department. What happened was really people got referred to us after the emergency room visit. But once they established care with us, 76% of them cease using the emergency room within the next...
At great savings to the system.
At great savings to the system, because 43% of them are uninsured.
Okay. Mr. Harvey, you talked about diseases of despair, something that I have studied for quite a while. Tell us a little bit about what happens in rural America when people have no hope, no access to health care they need.
Yeah, it's a great question. I mean, deaths of despair is kind of what it describes, right? You see worse chronic diseases, substance use disorders creeping in, particularly in the county I grew up in, as manufacturing jobs left. And without access to care, mental health care, substance use disorder treatment, those things get worse, and they get worse quickly. I think you see that too with suicide, right? Increased rates of depression, increased rates of hopelessness in rural America is really this is maybe too broad of a statement, but it's in dire straits. You see hospital closures, and health centers can be, in fact they are, right? They are that rate limiter. They've stepped into a lot of those areas, and certainly in Indiana, and especially from substance use disorder, chronic disease treatment, provide that opportunity to, one, hold back the tide, and two, reverse that.
Let me ask anybody on the panel. We are the richest country in the history of the world. We now spend twice as much per capita on health care as any other people. In your judgment, is it in fact too much to ask that every American at least have access to quality primary health care? And as Senator Cassidy mentioned, that includes dental care, mental health counseling, lower cost prescription drugs. Is that too much to ask in the United States?
As I said in my testimony, that's been my life's commitment, is to ensure that we remove those barriers that prevent everyone from having access to that kind of care that also drives healthy behaviors that keep chronic disease controlled.
Anybody else want to comment? Is this utopian, out of the reach of the United States of
I
America?
don't think so. I think you're right. I mean, I think access to care, taking maybe the policy piece out of this, it obviously has policy implications, but access to care is one of the core, that's a core piece of the foundation to a healthy life, right? I have a son that has Down syndrome. Without access to care, right, life looks different for him, right? Life looks different for Hoosiers that don't have routine sources of primary care, that don't have routine sources of treatment. That really does matter.
Okay, thank you all very much. Senator Cassidy. A few more questions, then we'll wrap it up. We spend over 18% of our GDP on healthcare. That is almost double what any other country spends. And as broken as our general healthcare system is, it seems to me that our primary healthcare system is even more broken, with tens of millions of people not able to get to a doctor when they get sick. And I have talked to physicians in Vermont and around the country who tell me that people walk into their offices very, very sick, and sometimes with incurable illnesses that could have been dealt with if they walked in the door on time. And they didn't because they didn't have insurance. They were embarrassed not to have any money to pay. In your judgment, number one, would, at a time when we spend so much more than other countries on healthcare, if we provided at least primary healthcare to every man, woman, and child, we've had primary healthcare accessible to everybody, in the long run, would it save our healthcare system substantial sums of money? Ms. Vera, you're jumping to answer that?
I am, Senator. Thank you so much for the question. And I would say yes, maybe. But because the maybe is you also need to make sure that they not only have access, but the work is being done to connect them to the appropriate services. Because just having the access, it doesn't connect people to the appropriate services. Quality and population health management does.
But that runs us into another issue, again, having to do with the fact that we're the only major country not to have a national health care program. So somebody walks in and you make a diagnosis and say, well, sorry, you have breast cancer. Oh, but I can't afford the other treatment that I need, or I'm going to go medically bankrupt as a result. All right, who else wants to jump into the issue of the morality of providing health care to all people at a time when we lose? We don't talk about it very much, but studies that I have seen suggest that we lose over 60,000 people a year who don't get to a doctor on time, and that if we don't treat people, you said it, an ounce of prevention is better than a pound of cure. Are we spending on the cure, the tertiary health care, the $100,000 surgeries, rather than making sure people have the medicine and the primary health care they need? Amanda?
So I appreciate you putting it in that context, and I will just call out some of the comments that Senator Cassidy made earlier, that this is the wise investment. And to your point, it is about keeping people healthy. So if you keep them healthy on the front end, if you keep them out of the emergency room, if you keep their chronic diseases managed, if you keep them from getting severely ill, which you can do in health centers, yes, it is going to serve, and it is meaningful for the 100 million people that we've called out today, but really for everyone. Primary care is the path to success in healthcare, period.
Yes, Dr. Norfolk.
I would just add that a long history of research on primary care generally, specifically looking at comparative performance of health systems across countries, has reinforced that a strong, high-functioning primary care system is associated with a broad range of health system outcomes that we look for.
Is it fair to say that specifically in terms of primary care, we invest far less than other major countries?
Absolutely.
And that is perhaps one of the contributing factors why we end up spending so much per person on health care. Is that a fair?
That would be fair.
Yeah, okay. All right, well, listen, let me thank the panel for being here. You were great. We're talking about a major issue of concern to the American people, and it is my determination to do everything we can to come up with legislation that will improve and expand community health centers in this country and move us toward the goal of making sure that every person, you know, no matter where they may be, have access to primary health care. So that is the end of our hearing today. I want to thank all of our witnesses for the participation. For any senators who wish to ask additional questions, questions for the record will be due in 10 business days. That's March 17th at 5 p.m. Finally, I ask unanimous consent to enter into the record a statement from Senator Casey and statements from stakeholder groups outlining their priorities for community health. Mr. Mix, thank you very much. In America today, we are seeing large corporations and their consultants spend hundreds of billions of dollars trying to prevent workers from, in fact, joining unions. Let me ask Ms. Schuler, Ms. Henry, or Mr. O'Brien, why do you think these large corporations, often with CEOs like Schultz, who are billionaires, are spending so much money trying to make it impossible for workers to join union? Sean, did you want to respond to that?
Yeah, so, I mean, there's no secret that it's a $350 million.
Is your
It's a $350 million per year business. Look, I think it's clear, especially when you're dealing with the CEO of Amazon and Starbucks, that these CEOs and these corporations, all they care about is the bottom line of a balance sheet. And if there's any threat to that bottom line of a balance sheet or accountability, meaning that workers are being represented, workers are being compensated and represented clearly by unions, that's why there's such a big threat. My colleague on the end, Mr. Ring, makes a point saying, everybody's got a right to choose whether they want to belong to a union. Let's look at Starbucks. You have 300 locations that voted to join a union, and yet, you have these, union-busting firms spending $350 million a year. Look, we did exactly what you fight for, right? We voted, those workers voted to join a union. The company should be held accountable and sat down and made to negotiate an agreement.
Why? Let me just jump in and ask Ms. Schiller or Ms. Henry, why would workers want to join a union? I mean, do they do better? Give me some statistics here about how union workers are doing compared to non-union workers.
And it relates to your last question, too, that workers fundamentally want a voice. They want a seat at the table. And I think that someone like Howard Schultz misunderstands what unions are. There's this idea of, oh, this is going to hurt my business, and oh, this is going to restrain me from making decisions that I want to make. It's absolutely not the case. What it does do is increase productivity. It increases longevity and predictability for your business, because when workers are satisfied and they feel like they have a seat at the table, they're heard, they make better wages and have health care benefits, they're going to be more productive employees and make your business do better. We all want to win here, right? And I think there's a misunderstanding that unions want to see businesses fail. That is absolutely not the case, because when businesses fail, we don't have jobs, right? But yes, the statistics are very clear, Senator, that working people have, I think it's almost 15% more wages when you join a union, particularly for women and people of color. That adds up over to a lifetime, not to mention the having health care benefits, retirement security.
Let me ask Ms. Henry, SEIU, I know, has been very active in trying to organize low-wage workers in the fast food industry, the service industry. What does it mean to a worker who's making starvation wages when they're able to join a union?
It means a shot at a better life for themselves and their children. It means that I don't have to be subjected to sexual harassment or race discrimination on the job, because I need this job in order to pay my rent or pay my groceries. It means that I might be able to dream that it's possible for my child to do better than I've done if I'm able to join together in a union and end the starvation wages that you talked about at the beginning of this hearing, and get on a path to living wages with benefits that create some stability in people's lives where they can make plans for the future.
Let me go back to Sean. Your members, workers all over this country, see billionaires becoming much richer, while they often want cutbacks in health care or wage increases that are not keeping up with inflation. How do workers feel about this huge increase in income and wealth inequality and the greed that we're seeing on the part of corporate America?
Well, I can tell you, my members, 1.3 million members nationwide, they provided goods and services to this country probably in the toughest times through the pandemic with total disregard for their safety and the safety of their families when they were going home. They were going out providing parcel delivery, providing food distribution, providing rubbish pickup, providing every essential service that we may take for granted at times. And all the while, all these big corporations like UPS, Republic Waste, Kroger's grocery warehouses, they were making record profits while our members, in some cases, were losing their jobs.
And losing their lives.
Losing their lives, and not gaining in some of these profits that these businesses and these corporations, which my members feel today that they were taken advantage of. And I think there's a lot of workers, not only unionized workers, but non-union workers that feel the same way, especially in light of what we just came out of.
I've gone over my time, and I'll give Senator Cassidy equal time. But my last question, do we have any statistics about how many thousands of workers died during the pandemic, keeping the economy going, while the billionaire class became richer? Do we have any numbers on that?
I can tell you that in the healthcare sector in this country, we're still trying to get the data, Senator, but it is criminal what happened in our nation's nursing homes and hospitals in the beginning of the pandemic when we were not getting personal protective equipment that we needed in our nation's nursing homes for both the caregivers and for the residents.
It is fair to say thousands of workers died on.
Oh, yes.
Many thousands.
Yes.
Okay, I've gone over my time. Senator Cassidy.
I'm going to defer to Senator Mark Wayne Mullen.
Thank you, Ranking Member. Thank you, everybody, for being here. And I want to make it very clear.
Thank you very much, Mr. Chairman. Let me thank the panel for being with us today. Mr. Shaw, you indicated in response to a question from the chairman that you, quote, "I'm committed to doing what's right," end quote. Well, I think all of us are committed to doing what's right, but the devil is in the details. Mr. Shaw, Wall Street, about a decade ago, in order to increase the profits they were earning in the rail industry, implemented a program called Precision Scheduled Railroading. The result of that is that Norfolk Southern reduced its workforce by almost 40% over 6 years. Meanwhile, in fact, Wall Street's goal was achieved. Profits soared for Norfolk Southern. You made over $3 billion in profits last year. I have been told by workers who work for your company and other rail companies that they are now being asked to do more work with fewer workers, and that includes safety inspections. So well before this disaster in East Palestine, we have been told about the potential safety hazards. Will you make a commitment right now to the American people that you will lead the industry in ending this disastrous precision scheduled railroading, which has slashed your workforce and made railroading much less safe? Yes or no, will you make that commitment?
Senator, I understand your concern, and I share that concern. And if you'll permit, I have a couple points on that. I became CEO in May of last year. Ever since that point, Senator, we've been on a hiring spree. The number of employees at Norfolk Southern today is 1,500 more than it was this time last year.
You'll forgive me, I don't mean to be rude. We just don't have a whole lot of time. Yeah, I understand that, but you will not deny what you're trying to do is rebuild from the massive layoffs that took place. My question back to you again. Wall Street, not the industry, imposed this on the industry. Wall Street said we're not making enough money. Cut workers, cut workers, cut workers, even if it endangers safety. My question to you, very simply, sir, will you lead the industry in doing away with precision scheduled railroading? That concept.
Senator, in December of last year, I charted a new course in the industry. And I said we're going to move away from a near-term focus solely on profits, and that we're going to take a longer-term view that's founded on our engagement with our craft employees who are so critical to our success. We were the first to pivot out of it.
All right, well, let me jump in again. I apologize for cutting you off here, but when you talk about your employees, the entire country, I think, was shocked to learn a number of months ago that your employees, rail workers, who work in a dangerous job in all kinds of weather, had zero paid sick days. Now, I know that is beginning to change, but I would ask you, given the fact that Norfolk Southern provided $10 billion in stock buybacks recently, can you tell the American people and your employees right now that in order to improve morale in your workforce, that you will guarantee at least 7 paid sick days to the 15,000 workers you employ? I do know you've made some progress. You increased paid sick days for some of your workers. Will you do what most Americans think is pretty obvious, that when you get sick, you get guaranteed paid sick days? Will you make that commitment right now to your entire workforce?
Senator, with our latest agreement with our employees, which included a historic 24% wage increase and access to premium health care benefits, we immediately pivoted to talking to each of our local...
I've been deeply involved. I introduced the amendment on the floor. I know the issue. But what I'm asking you right now, you provided paid sick days to some of your employees. I got it. Thank you. Will you now do it what we get here in Congress? Our employees get sick, they get paid sick days. Will you make that commitment right now to guarantee paid sick days to all of your workers? That's not a radical demand. It really is not. Will you make that commitment, sir?
Senator, I share your focus on our employees. I will commit to continuing to discuss with them important quality of life issues with our local craft colleagues.
In all due respect, you sound like a politician here, Mr. Shaw. It's not paid sick days is not a radical concept in the year 2023. I am not hearing you make that commitment to guarantee that to all of your workers. Clearly, we should have that for every worker in America. I'm not hearing that commitment. Will you make that commitment, sir?
Senator, I'm committed to continuing to speak to our employees about quality of life issues that are important to them.
All right. Well, I'm chairman of the Health, Education, Labor Committee. We look forward to having that discussion. One last issue. You talked about covering...
Senator Graham, Senator Graham is waiting to ask it, so Bernie, if you just keep it really brief.
All right, last question. You talked about covering the needs of the people of East Palestine. Does that include paying for their health care needs? All of their health care needs?
Senator, we're going to do what's right for the citizens of East
What's
Palestine.
right is to cover their health care needs. Will you do that?
Everything is on the table, sir.
Thank you.
All right. Thanks, Senator Sanders.
Mr. Bitzel, thank you very much for your testimony. You sent us I think it's a 9-page, single-spaced document, longer than your testimony. We appreciate that. But in these 9 pages, as I read it, you did not mention the National Institute of Health, the NIH, once, nor the research that they did. As I mentioned earlier, according to a letter I recently received from the NIH, distributed to all members, what the NIH says is that 3 scientists at the NIH, quote, are co-inventors and were integral members of a collaborative team of scientists working to design and produce it. That's the scientists at the NIH, not to mention the many billions of dollars of federal government that came to Moderna in order to produce the vaccine and do the clinical trials. How come, in your judgment, what role did the NIH play in co-authoring and developing this vaccine?
Thank you, Mr. Chairman. Let me start by saying that we have a lot of respect, great respect for the NIH team, and we believe what the NIH does for this country and for the world is really important to advance science that industry might not fund. What happened when the sequence came online is our team at Moderna were working on the technology. The way one needs to think about Moderna is like an operating system. What we spent 10 years doing is developing all the tools to make products.
All right, I don't mean to be rude, but isn't it absolutely true that the NIH was also doing that, had done research for many years on that same area?
So what is correct, Mr. Chairman, is that the NIH has worked on the virus and on the protein. So what our team did is develop the mRNA molecule. What the NIH did, which was a great confirmation, is they designed the same protein than our team did in parallel. But the design of the mRNA vaccine was done by our team. This is our technology.
The NIH considers themselves to be co-authors of the vaccine. Do you disagree?
So our team have been working through that discussion for quite a while. We had agreed to disagree. The team is following US IP law, which is very important. And what we've done to close the matter is we actually have decided to abandon that patent. We have abandoned that patent. The NIH is aware of it. And we are moving on because we cannot agree on what happened. The mRNA molecule was designed by the Moderna team. That is our technology.
Mr. Bancel, in terms of the role that the U.S. government and taxpayers of this country had in terms of the success of Moderna, let me read to you a quote from Boston Magazine, June 4th, 2020. And the quote says, quote, "The U.S. government announced it was funding Moderna with nearly $500 million. The news sent Moderna's stock price so high that Bancel became a billionaire overnight." End of quote. Comment?
So what the government has done through Operation Warp Speed was a moment that can only happen in America. We were facing a virus. This was the common enemy. This didn't come out of Europe or other governments. What the US government did to say, we need to fund 6 different companies, 6 different technologies to be able to get at least 1 or 2 vaccines working. That was really the government did.
Forgive me, I don't mean to interrupt you. I just don't have a lot of time. Everybody else is going to want to ask the question. But here's the point. It was announced that the federal government put money into Moderna. You became, the stock prices soared. You became a multi-billionaire overnight. So it's hard for me not to believe that the federal government played a major role in the development of this drug. But here is the main point. I don't want to talk about what happened 3 years ago. We're here today. You're a multi-billionaire. Other people, top executives in your company are multi-billionaires, all developed as a result of the vaccine. And now we have a situation where you are proposing to quadruple the price of the vaccine once the government stockpile runs out. That will mean that not only, and we'll talk about later on the patient assistance program, but in terms of government, in terms of Medicare, Medicaid, other government agencies, taxpayers are going to have to spend substantially more money. My question to you is, given the fact that you have made billions of dollars, that your company has made huge profits, on behalf of the taxpayers of this country, will you reconsider your decision to quadruple the price of the vaccine?
So Chairman Sanders, what we have to do is to deal with the complexity I described, and I'm happy to go into more detail through this hearing. This is not the same product. We used to have 10 doses in each vial. Now we're going to have every vial will have a different dose. This is not the same.
I understand it, but quadrupling the price is huge, and I would hope very much that you will reconsider that decision. It's going to cost the taxpayers of this country billions of dollars. Is that something you can do?
The volume we had during the pandemic gave us economies of scale we won't have anymore. That is why it's different.
Okay. Senator Cassidy. Committee on Health, Education, Labor, and Pensions will come to order. Let me begin by thanking Mr. Bancel, the CEO of Moderna, for being with us today, and all the other panelists who will be joining us. Mr. Bancel very early on agreed to be here voluntarily, and I appreciate that very much. I also want to take this opportunity, so there is no confusion, to congratulate Moderna, Pfizer, other companies, and the great scientists at the National Institute of Health and other federal agencies for their extraordinary work in rapidly producing COVID vaccines that have saved millions of lives. We should be grateful to all those in government and in the private sector who work so hard to save lives. This hearing, to my mind, is about several enormously important and interrelated issues that are on the minds of the American people. In the pharmaceutical industry today, we are looking at an unprecedented level of corporate greed, and that is certainly true with Moderna. Today, according to a recent survey, 37% of the American people could not afford the prescription drugs their doctors prescribe. Got that? Over 1/3 of the American people can't fill their prescription drugs that their doctors prescribe. Meanwhile, 10 major pharmaceutical companies made over $100 billion in profit in 2021, a 137% increase from the previous year. In these same corporations, the 50 top executives made over $1.9 billion in total compensation in 2021 and are in line to receive billions more in golden parachutes once they leave their companies. In other words, all over this country, in Vermont and in every state represented here, people are getting sicker and in some cases dying because they cannot afford the outrageous cost of prescription drugs while these companies make huge profits and the executives become billionaires. Further, and many Americans don't know this, the taxpayers of our country have spent many tens of billions of dollars over the past decade to research and to develop life-saving medicine. And in my view, that is a good investment. Yet, despite that huge amounts of money and the vitally important work done by the National Institute of Health scientists, the citizens of the United States pay far more for prescription drugs than do the people of any other country on earth, in some cases 10 times more for the same exact drug. Unbelievably, there are important life-saving drugs on the market today that literally cost hundreds of thousands of dollars, cancer drugs and other types of drugs. And my simple question is, what does a life-saving drug mean for a person who cannot afford that drug? You have all the great drugs out there in the world, but if you can't afford it, what does it mean? Now, in terms of Moderna, the focus of our attention this morning, let us be clear. The NIH and other federal agencies work with Moderna to research, develop, and distribute the COVID vaccine that so many of our people have effectively used. While Moderna may wish to rewrite history, it is widely acknowledged that both Moderna and the NIH created this vaccine together. According to a letter I received from the NIH on March 17th, and which has been distributed to all members of the committee, 3 scientists at the NIH, quote, are co-inventors, end quote, of this vaccine who were, quote, integral members of a collaborative team of scientists working to design and produce the vaccine. In other words, this vaccine would not exist without NIH's partnership and expertise and the substantial investment of the taxpayers of this country. As a matter of public record, U.S. taxpayers spent $12 billion on the research, development, and procurement of the NIH Moderna COVID vaccine. And here is the thank you that the taxpayers of this country received from Moderna for that huge investment. They are thanking the taxpayers of the United States by proposing to quadruple the price of the COVID vaccine to as much as $130 once the government stockpile runs out. At a time when it costs less than $3 to manufacture the vaccine. $3 to manufacture it, $130 on the market. What this means is that Moderna will be charging Medicare, Medicaid, the VA, the Department of Defense, the Indian Health Service, and insurance plans, private insurance plans on the Affordable Care Act, billions of dollars more for the COVID vaccine. So all of us who are concerned about the deficit, the national debt, billions more goes to Moderna. Meanwhile, Moderna has already made $21 billion in profits off the COVID vaccine during the pandemic, and 4 of Moderna's executives and investors collectively became more than $10 billion wealthier as a result of the massive taxpayer investment into that corporation. As soon as Moderna started to receive billions of dollars from the federal government, Mr. Bancel literally became a billionaire overnight and is now worth over $4 billion. He was also able to secure a golden parachute for himself worth another $926 million after he leaves the company. But let's be clear, Mr. Bancel is not alone. One of Moderna's co-founders, Noubar Afeyan, is now worth $1.8 billion. Another co-founder, Mr. Langer, is now worth $1.7 billion, and one of the founding investors in Moderna, Tim Springer, is now worth $2.2 billion. None of these 4 individuals were billionaires before the taxpayers of our country funded the COVID-19 vaccine. This type of profiteering and excessive CEO compensation is exactly what the American people, whether they're Republicans, Democrats, or independents, are sick and tired of. And that is why this morning I will be asking Moderna and Mr. Bancel to reconsider their decision to quadruple the price of this vaccine and not raise the price at all. Let me mention that after this hearing was announced, Moderna pledged that its, quote, vaccines and boosters will continue to be available at no cost for the vast majority of people in the United States, end quote, through the creation of a patient assistance program. That is good news. The bad news is that most patient assistance programs are poorly designed and extremely difficult, and I will be asking Mr. Bancel to make certain that this patient assistance program is simple, non-bureaucratic, and in fact gets out to the people who need it. Let me pose, if I might, a moral question that we ask too rarely, but that I hope that this committee will address in the months in front of us. And that is, above and beyond the COVID vaccine, should people in our country and around the world get sicker and sometimes die because they cannot afford the outrageous prices that the drug companies are charging? Is it morally acceptable to say, I have a drug here that can cure you, save your life, but I'm sorry you can't afford the $50,000 that it cost? Is that the moral values of the United States of America? And I would contrast that attitude that we see today from Moderna and virtually all the other drug companies with what Jonas Salk said when he invented the polio vaccine that had such a profound impact. And you know what he got for inventing the polio vaccine? He got nothing. And he was proud of it. He gave a gift to the world that saved God knows how many lives. So I think we need to do some moral thinking about the role of the drug companies in our society, and I hope this committee will get into that. And with that, the issue we're really discussing today, and Senator Lujan raised it, I think, significantly, is some of us have a hard time understanding how a company that made $21 billion in profit, a company that enabled you and your associates to become multi-billionaires, a company that would not have developed this vaccine without the help of the taxpayers of this country, now comes before the public and says, oh, by the way, we want to quadruple prices, which will mean that the deficit goes up or taxes go up because of the increased expense that Medicare and Medicaid and VA have to pay. So I concur with Senator Lujan about that issue. I want to ask you, earlier, in response to Senator Smith, you talked about negotiating prices. Am I hearing from you that, in fact, you are prepared not to charge $130 for a vaccine to the U.S. government, but less than that? Is that what I hear?
What I'm saying, Mr. Chairman, is there's a list price. It depends if it's a single-dose product or a pre-filled syringe product. There's a list price around $130. And then with different customers, there are going to be discussions.
But, that's an issue that many have raised. We have no transparency in pricing. It is a totally insane situation. Everybody pays a different price. The United States government helped you develop that vaccine. It is a huge consumer. Are you prepared to substantially charge less for the vaccine to the United States government and our agencies?
Given the situation at hand, Mr. Chairman, we have no idea of the volume that we need this year. We have very increased complexity.
Yeah, you have complexity, but you have money for stock buybacks by the billions, and you guys became billionaires. That doesn't seem too complex to me. Let me ask you this question, at least. The United States pays, the people in our country pay the highest prices in the world for prescription drugs in general, something this committee will work on. Will you at least tell us today that the price you are charging for the vaccine will be lower than what other countries around the world are paying? Or once again, we're going to pay the highest prices?
So, Mr. Chairman, the price will depend on the value in each country. The cost of healthcare is different in each country.
That's not the answer. That's a whole, all right. I'm asking you a simple question. Your vaccine was developed with the help of the United States government. I am asking you whether or not we're going to continue to pay the highest prices in the world for that vaccine. I understand everything is complex, but I also understand you have money for stock buybacks and exorbitant compensation packages for yourself. Will you at least tell the taxpayers of this country that the price we pay for the vaccine will be less than other countries?
I cannot say that the price will be lower than other countries.
All right, let me ask you this. When you talk about value, it's an interesting philosophical concept. In your judgment, what does value mean to a woman who lost her husband because the family cannot afford the outrageous price of a prescription drug? Is that a value that we should consider, or is that a value that we should consider?
We believe in access, Mr. Chairman. And as I said, our products, we're going to work really hard for the uninsured, that they are available for no cost.
And I understand. I may be asking you a broader question than just Moderna. Senator Markey mentioned Pfizer having a cancer drug for $175,000, I believe is what he said. All right?
Another company.
That's another company. Of course, I know that. But I'm asking your statement. You talk about value, and the value is, well, we've helped the economy and we've done all these things. True enough. But what about the value of human lives that are lost or the suffering while companies make billions and people can't afford the price? Is that a value to be considered?
Of course, Mr. Chairman, we need to work together, industry and the governments and all the players in the healthcare system, to figure out how do we make sure the products are available. I completely agree with you. We work hard to make medicine and to do science to help people. So I agree with you.
Well, you raise an interesting question. Okay, and Senator Cassidy, and Senator Romney talked about it. Now, tell me this, and this is kind of a value issue that I think we should really get into as a nation. Jonas Salk, you're familiar with Jonas Salk, invented polio. Did not make billions for his invention. In fact, he gave it away. And he said, I'm so proud to have created this vaccine, to save lives. Alexander Fleming developed penicillin, a huge advance for medicine, saved, millions of lives? Frederick Banting sold his intellectual property for $1 for insulin. All right? What do you think about those guys and those scientists who said, you know what? Our function in life is to create wonderful drugs that will ease human suffering and save lives, not to become excessively rich. Do you think they were crazy?
I think what they did was very noble. I think what we have to do is to invest in the technology. If we didn't have a technology when the pandemic happened, there would have been no Moderna vaccine, Mr. Chairman.
Look, we all agree that we need the technology, but what I am asking you, and some of my friends here are saying, is that the only thing that motivates you is to become a billionaire.
That's not true.
All right, but then can we have a science where people get paid well? I have no problem with Moderna making money, but you're hearing here massive cash paybacks, you becoming a multi-billionaire. Should we develop a counterculture, perhaps, which says your motive is not just making billions, but developing all of the drugs we need for the terrible diseases that this world faces?
And that's what we're doing, Mr. Chairman. That's why Moderna is a different company. Our number one investment this year is in R&D. As I mentioned, $4.5 billion.
How much do you put in stock buybacks?
Sorry?
How much do you provide in stock buybacks?
We have not decided yet as a board. The number of a stock buyback that's still open is $2.8 billion, I think. Yeah. Our number one priority is R&D. If we could invest more in R&D, we would. The challenge we have is phase 3 studies takes time to happen, Mr. Chairman.
Let me ask you this. And again, I'm directing it to you, but it really applies to the whole industry. If we were to say to you, if the government were to say to you, look, we're interested in cures in cancer, obviously, diabetes, all the other, Alzheimer's, all the other terrible illnesses we face. We are prepared to make sure that your company makes a good profit. Maybe you don't become a multi-billionaire, but you make a good profit. And if you develop a cure for that particular disease, you're going to make money on it, but we're going to take the intellectual property and make it available to the whole world so that people all over the world at a very reasonable price will be able to benefit from that discovery. You make money, the world benefits. Everybody affords it. What do you think about that concept?
So what is really hard in this industry, Mr. Chairman, is the risk of failure. Most drugs fail. 90+% of drugs in clinical trial fail, as you are aware. And that's what makes it really, really hard. What we want to do is to get access. Let me share, please, a couple examples. We are working on having a plant in Kenya to help low-income countries. There's an example of a rare disease called Crigler-Najjar. It's very small, 100, 200 kids. We couldn't find a way to do it, or it'll be too expensive.
Right, but if we said to you, all right, we're going to cover, you're not going to fail, you'll be compensated. All right, we're willing to pay you good money. You're going to get rich, maybe not a multi-billionaire. You'll do very, very well. We'll cover the risk. But if you succeed, that formulation is going to be available to people all over the world so that they can get that drug. We covered the risk. What do you think about that?
I will have to look into the details, Mr. Chairman, because, again, the risk is I don't know how you manage the risk. I mean, are you suggesting in that thought process that the government will pay all of R&D of the entire industry?
Yeah, exactly what I'm suggesting.
Oh, okay.
That's the deal. We're going to cover the R&D. You succeed. You're going to make profit, but the product goes all over to the world so that people can afford it.
I think we'll have to understand the details to have an opinion.
See, Senator Markey made the point that I think millions of people appreciate. You can come up with all the great drugs in the world. We appreciate that. But if people can't access them, or they go broke, or they go bankrupt having to buy them, it doesn't mean anything to those people. And certainly, by the way, we're talking about America, the wealthiest country on earth. What about Africa and poor people around the world? Should they die because they cannot afford that prescription drug? Senator Cassidy.
I will be very short.
Limited is the time of all of our members here. So I'm going to be asking you to respond to each question as briefly as you can, hopefully with a yes or a no. Do you understand that in America, workers have a fundamental right to join a union and collectively bargain to improve wages, benefits, and working conditions? Do you understand that?
I understand, and we respect the right of every partner who wears a green apron, whether they choose to join a union or not.
Are you aware that NLRB judges have ruled that Starbucks violated federal labor law over 100 times during the past 18 months, far more than any other corporation in America?
Sir, Starbucks Coffee Company unequivocally, and let me set the tone for this very early on, has not broken the law.
Okay. Are you aware that on March 1st, 2023, an administrative law judge found Starbucks guilty of, quote, egregious and widespread misconduct, end quote, widespread coercive behavior, and showed, quote, a general disregard for the employees' fundamental rights, end quote, in a union organizing campaign that started in Buffalo, New York in 2021. Are you aware of that?
I'm aware that those are allegations, and Congress has created a process that we are following, and we're confident that those allegations will be proven false.
All right. Mr. Schultz, before answering the following questions, let me remind you that federal law at 18 U.S. Code Section 1001 prohibits knowingly and willfully making any fraudulent statement.
I understand that.
Were you ever informed of or involved in a decision to fire a worker who was part of a union organizing drive?
I was not.
Were you ever informed of or involved in a decision to discipline a worker in any way who was part of a union organizing drive?
I was not.
Have you ever threatened, coerced, or intimidated a worker for supporting a union?
I've had conversations that could have been interpreted in a different way than I intended. That's up to the person who received the information that I spoke to him about.
Were you informed of or involved in the decision to withhold benefits from Starbucks workers in unionized stores, including higher pay and faster sick time accrual?
My understanding, when we created the benefits in May, 1 month after I returned as CEO, my understanding was under the law, we did not have the unilateral right to provide those benefits to employees who were interested in joining a union.
Am I hearing you say that you were involved in the decision to withhold benefits from Starbucks workers in unionized stores? Is that what I'm hearing?
It was my understanding that we could not provide those benefits under the law.
Mr. Silch, have you ever asked a Starbucks worker, quote, if you hate Starbucks so much, why don't you go work somewhere else?
I'm glad you asked that question because I've read in the press that quote, and that's not exactly what I said. Can I tell the story? Do you mind?
I have some other questions. I'm sorry. There are a lot of people.
I think it's important to hear the facts.
All right, you'll have your chance. Will you commit to testifying in any trial where you personally are accused of breaking federal labor law, something that you have been accused of doing nearly 100 times since 2021?
Mr. Chairman, let me say under oath, these are allegations and Starbucks has not broken the law.
Okay. Mr. Schultz, were you informed of or involved in the decision to close all Buffalo area stores in November 2021, just days before area union elections, in order for Starbucks employees to listen to you give a speech on why they should vote against forming a union, a meeting the NLRB has determined was a violation of the law?
I think this is another area that I hope I get a chance to speak about. For the last 12 months, my involvement, my engagement, and my return to Starbucks has been primarily, I would say 95%, focused on the operations of our business, the customer, domestically and around the world. My involvement and engagement in union activities, despite this event today, has been de minimis. I was not involved in any issue of closing stores.
Are you aware, Mr. Schultz, that an administrative law judge ordered you to record and distribute a video of yourself reading a notice to Starbucks employees about their rights under the National Labor Relations Act, how Starbucks violated those rights, and to assure that Starbucks will not infringe upon those rights in the future, and that this notice must be posted in all Starbucks stores and shared digitally to all of Starbucks employees? Are you prepared to read that notice?
No, I am not, because Starbucks Coffee Company did not break the law.
Under your leadership, Starbucks has repeatedly refused to bargain with any of the 7,000 workers in nearly 300 stores where workers have voted to represent themselves through a union. The first group of workers to win their election have been waiting more than 460 days to reach a first contract. Mr. Schultz, will you commit right now that within 14 days of this hearing, Starbucks will exchange proposals with the union, something it has refused to do for more than 450 days, so that meaningful progress can be made to bargain a first contract in good faith? Will you make that commitment?
Because the arrangement that was made by the union and the NLRB in Buffalo to negotiate one single store at a time, we have met over 85 times for a single store. We've tried to arrange over 350 separate meetings. We've said publicly, and I say it here again, that we believe that face-to-face negotiations is the way to proceed. And the reason I want to make that point is that there have been safety issues in which Starbucks managers have been outed on social media. There are privacy issues. We don't want to do it on Zoom. We are prepared to meet face-to-face on a single store issue.
Will you make a promise to this committee that you will exchange proposals with the union so that we can begin to make meaningful progress?
On a single store basis, we will continue to negotiate in good faith. That's what we'll do.
2 minutes over.
Senator Cassidy.
I defer to Senator Paul.
Ayn Rand's Howard Roark points out the ingratitude.
And as the son of an immigrant who came to this country without a nickel in his pocket, I very much appreciate what you have said. It's the story of millions of Americans. I want you to continue your opening statement in terms of giving us your sense of what your major accomplishments have been, what you're proud of in terms of the work you did in California, what you have done in the last several years here in the Department of Labor, and maybe more importantly, what your vision is. What do you want to do? What are the problems that you see out there, and what do you want to accomplish as our Secretary of Labor?
Well, thank you so much, Chairman Sanders. Thank you also for the meeting that we had. I know that we talked about how we need a Secretary of Labor who is going to deliver in this moment, and I really enjoyed our conversation. And thank you for that question. You've already laid out so clearly what a historic economic recovery this has been. The president says it himself all the time, right? This is what it looks like to build an economy from the bottom up and the middle out. And I've been a part of the administration for the last 2 years. I've been very proud to see what good, thoughtful policy and implementation look like. Because of that work, in partnership with Congress, our economy continues to defy expectations. 12.6 million jobs represents a mom getting back to work after the disruption of COVID. It represents a veteran coming back from military service and getting a seamless transition into civilian life. One woman I met is now laying pipes 30 feet underground and doing a job that she never imagined for herself. And when she comes home at the end of the day, her hands are dirty, but she says her children are really proud of her. I think that 12.6 million jobs is 12.6 million stories like that.
Let me ask you this. You touched on it in your remarks, and it's something this committee, I hope, will be able to deal with in a bipartisan way. You mentioned that there are, in so many words, there are millions of young people who do not necessarily want to go to college, who are prepared to get their hands dirty, go out, earn good wages, doing some of the important work that needs to be done to rebuild America. Talk a little bit about your vision of strong apprenticeship programs for our country.
So there's so much we can do there. Thank you so much, Chairman Sanders. And we've been doing it over the last 2 years at the Department of Labor. We have dramatically expanded apprenticeships across the country. We have, just in the last 2 years, over 4,600 new apprenticeship programs representing 11,000 or so employers. These are opportunities to make sure not only that job seekers, and in particular young people, get the high quality skills training that they need but that employers who are looking for skilled workers to do the many things that we are doing right now, right? Rebuilding roads and bridges and ensuring broad internet accessibility to communities all across the country, making sure that every family that turns on the faucet gets clean drinking water out of it, building coast-to-coast electric vehicle charging stations. All of this work needs workers. And employers have been saying that, what are we going to do to make sure that we have the workers that we need? And apprenticeship programs are a big part of that answer. Our overall workforce development system is a big part of that answer. And my team has heard me say this at the Department of Labor many, many times. We can build physical roads and bridges. We also have to build the roads and bridges that connect people to the jobs they need. That's what the system
What
will
I'm
do.
hearing from you as Secretary of Labor, you're prepared to work with this committee to greatly expand apprenticeship programs in this country. Child labor is an issue, as Senator Padilla mentioned a moment ago, of great concern. You have some experience in that issue. Tell us what you would like to accomplish to make sure that kids in this country are not exploited by unscrupulous employers.
Thank you very much for that question, too, Chairman Sanders. As we have seen, there's been increased attention to the truly horrific examples of child labor that we've seen of late. To be clear, we're not talking about a young person who's getting their first summer job at the local retail store working the cash register, where they're learning how to show up on time and work with customers. In the case, the most recent case that the Department of Labor found, it was over 100 children as young as 13 working in meat packing facilities on the night shift doing cleaning work. I think we can all agree that that is exploitative child labor that we do not want to see, and the Department of Labor is not only continuing to enforce the law, we're also leading an interagency task force across the federal government to make sure that we are exchanging information as needed and bringing all of our resources to bear, and that's another thing I would look forward to working with this committee and Congress on if asked.
Okay, thank you very much. Senator Cassidy.
Thank you, Ms.
Thank you very much. Let me start off with a question for Ms. O'Connell and Dr. Walensky. Nobody can predict what the next public health emergency will be. But in a sense, our job, and more specifically your job, is to put us in a position where we can react as effectively as we can so we don't lose over 1 million people next time around. So my question is a pretty simple question, and maybe Dr. Califf can jump in as well on this one. Are we moving forward right now? Can you tell us confidently that we are moving forward as fast as we can with creating the kinds of vaccines we may need in anticipation of the next pandemic? Do we have the kinds of treatments? Are we moving? I know you may not have them today, but are we moving aggressively forward to have the treatments that we need if people become ill? Do we have the workforce infrastructure that we need? Are you confident in telling us that you can move rapidly when you learn that a pandemic is, that we are facing a pandemic, and that you could rally all the resources that you need? Do we have the medical personnel to staff our hospitals if, God forbid, we find ourselves in the same position again? So, Ms. O'Connell, can you start off with that, please?
Chair Sanders, thank you so much for this question. This is one of my biggest worries, is that we are losing time in preparing for the next pandemic. It's the reason why the administration requested $88 billion last year to advance the American Pandemic Preparedness Plan. We did not receive that funding. We've requested again in our FY24 budget $20 billion, of which 10 would go to BARDA, to begin that research into the prototype vaccines, therapeutics, and diagnostics for those 7 viral families most likely to cause the next pandemic. You know, we were so lucky, I know it doesn't feel like it, but the one place we were lucky when it came to the coronavirus is we had already done a lot of the early work on that because of SARS and MERS. We need to get the same head start.
Are you telling us that we have not done the kind of work you would like to see us done in preparation for what may be coming?
Correct, not in all the viral families.
Okay. Dr. Walensky?
Thank you for that question, Chair Sanders. So we started with a very frail public health infrastructure from years, decades, in fact, of underinvestment. Some have estimated we have 80,000 public health work jobs in deficit right now. In fact, your own state of Vermont hired 120 people during the COVID-19 pandemic, and through our workforce infrastructure, you're able to retain, a workforce infrastructure grant, you're able to retain 12 of those 120. So it just gives you a sense of how frail and of the workforce infrastructure. In addition, the vaccines.
Let me interrupt you. Are you concerned that so many doctors and nurses are leaving the profession for a lot of reasons, but including the burnout and the stress they experienced during COVID?
And public health workers, deeply. Yeah. Yes, deeply. I will also note that.
I don't mean to be interrupting you
No.
all the time. What ideas do you have as to how we can rebuild that critically important workforce?
So much of the workforce authorities that we are looking for in public health specifically, things like tax-exempt loan repayment to entice people to come in. We know our laboratory.
Can't we do a little bit better than tax-exempt loan repayment? We have a massive workforce shortage.
We
need thousands of new workers.
Indeed, we do, and and many of these physicians, for example, come out of medical school with $200,000 worth of debt.
So that seems like a very modest. Too modest.
And work and direct hire authorities, flexible pay, danger pay, for example. I have colleagues in Equatorial Guinea right now on the front lines of a Marburg outbreak, and they are not getting danger pay. So these are the workforce things that we need to do to entice people to come into health and public health. So those are many of the things that we're asking for as part of this reorg.
So what I'm hearing you say is, despite good intentions, your agency is not as prepared as it should be, if God forbid.
I would agree with that, yes.
Okay. Dr. Califf?
What I'd say, Senator, is that when it comes to technology, we are unsurpassed and ready to go with regard to drugs, devices, vaccines, tests. But when there's a profit to be made, the American industry is premier and goes for it and is producing amazing things. For the public health, we have a gap in translation, which is what my colleagues here are referring to. When there's not a profit at the end of that pipeline, we need to have the funding in order to stimulate the industry to produce these products that we're going to need for the future. And as a former practicing doc until very recently, I'm very concerned about the thing that you all referred to, and I want to stress the public health workforce, not just the docs and nurses. You lost a very important person yesterday. This is not, and it's emblematic of how hard this work is. We are way down in the workforce that we need across the board to implement. Just talk to any of your friends trying to get an appointment in a clinic, particularly in mental health these days.
Okay. Senator Cassidy.
I will defer to Dr. Marshall.
Thank you, Ranking Member and Chairman. Dr. Walensky,
we're not going to begin questionings, and I'll begin it. And let me start off by saying, if somebody in the real world is watching this hearing, they've heard every single person from the drug companies and from the PBM say, we are working tirelessly to lower the cost of prescription drugs, just knocking our brains out. And yet, at the end of the day, 1.3 million Americans are rationing their insulin. People have died, people end up in the hospital. And you're all working night and day to lower the cost. And all over the world, people are paying a fraction of the price, not only for insulin, but for other products, drugs, than we are paying. So I would appreciate very brief answers, because we don't have a whole lot of time up here. So let me start off with Eli Lilly, and I'm going to go down the line here. Mr. Ricks, since 1996, Eli Lilly increased the price of Humalog 34 times, from $21 to $275, same exact product. I am told that it cost $5 to manufacture this product. And the story is not different for the products produced by Novo and Sanofi. So my question to you and to the other drug companies, will you commit to this committee today that you will not increase the price of any insulin product again? Mr. Ricks?
Thank you, Chairman, for the question. As I mentioned in my comments, all we've done
brief,
is reduce
please.
the prices since I've been CEO. So I'm comfortable saying we'll leave our prices as they are for the insulins on the market today.
All of your products?
Yeah, in fact, we've been cutting them is the point I'm making.
You're not going to, Mr. Hudson.
We've said before we have a responsible and sustainable pricing approach. We've had it since 2017. Net prices continue to fall, and the net price for insulin today for Lantus is lower than it was when it was launched in 2001.
So I'm hearing from you that you will not increase the price of any insulin product again?
To repeat myself, we have a responsible pricing policy, the standard in the
Yes
industry.
or no would be the better answer.
We have a responsible pricing policy. We've set that since 2017.
All right. Mr. Jorensen.
Yes, so thank you, Senator. We are committed to limit potential list price increases to single digit. We have not taken any for the past many years. In fact, we see double-digit decline in the price we get for our insulins for the past 6 years. And our net price today is lower than when we launched our products. So we see a dramatic falling price for our insulins in the U.S. market.
Okay. Let me ask the drug companies another question before I get to the PBMs. And that is, there are a number of newer insulin products that all three of you have brought forth to the market. All of these insulin products still cost more than $300. Will you commit to doing to those products what you've done to your other insulin products and substantially reduce the price of all insulin products? Will you make that commitment to us?
Senator, we've capped the cost to the consumer at $35 for every Lilly insulin.
So that means, I may be mispronouncing it, Lyumjev, how do you pronounce that?
Lyumjev.
Lyumjev, wasn't close. All right. That's going to be sold for $35?
The patient will pay no more than $35 in the United States for that product.
Okay. Mr. Hudson, your product is Toujeo, is that what it is?
Yeah, and it's equal for us that it would be less than $35. If I could just add one quick thing, our most recent launch was Lantus at 60% lower list price that was not accepted by the system.
Okay, and the Fiasp is sold by Novo Nordisk. Mr. Jorensen?
Yes, and I can also confirm that we have availability of insulin that is below $35 for all of our insulins for patients if they want that support from us.
All right, thank you. Let me ask the PBMs a question. It's a simple question, and I would appreciate a yes or no answer. Will you commit today that your companies will put insulin products on your formularies with the lowest list price? Mr. Joyner?
We will commit to put the lowest cost product on our formulary, net of discounts and rebates. So whether it be the low list price or the high list price, our job is to deliver the lowest net cost, post-discounts, discounts off of high and or low list price.
Dr. Kautzner?
Thank you for the question, Senator Sanders. We will commit to putting the lowest net cost product on formularies. However, we also have other formularies that are other choices for our employers to choose from, which do have low list price products also available. So we offer multiple different choices to our employers.
Ms. Cianfrocco?
We commit to always providing the lowest cost option to our clients, so the lowest cost. And other products are available to other clients through other formularies.
Thank you. All right, let me go back to Mr. Ricks. Mr. Ricks, Eli Lilly charges $196,000 in the United States for Cyramza, a stomach cancer drug. That same drug can be purchased in Germany for just $54,000. Will you commit to this committee to lower the price of Cyramza in the United States to the same price that you're selling it in Germany, $54,000? Yes? No?
Respectfully, Senator, that product has been on the market for a while. We do expect biosimilar entry. That's the primary mechanism in the U.S. where the price will fall. When that occurs, I'm sure there'll be competition in the price.
So what you're telling me is that the American people will have to pay 4 times more than Germans do for the same product that you manufacture. Okay? Mr. Hudson, Sanofi is a French company. In France, Sanofi sells a thyroid cancer treatment, Capelsa, for $30,000 a year. Sanofi sells the same drug in the United States for $203,000 a year. It's 9 times as much. Will you commit to lowering the price of Capelsa in the United States to $30,000, same price as it's sold in France?
Over time, with the introduction of competition and other biosimilars, et cetera, you'll see the price fall.
Yeah, so the answer is no. Mr. Urenson.
Mr. Chairman?
Yeah.
I hate to interrupt, but we are now, you're at 7 minutes.
You'll have the same amount of time, Senator.
Does every member have that?
Absolutely. All right, thank you. Mr. Urenson, in Denmark, Novo Nordisk sells a diabetes treatment, Ozempic, for $2,000 per year. That's 6 times more. You charge 6 times more to Americans. Will you reduce the cost of Ozempic in the United States to what it is in Denmark?
Senator, I believe the amount you mentioned for the U.S. is before rebates. So on average, we pay 75% in rebates in the U.S. And for Ozempic, we actually see a price going down, our net price going down year over year. So we get a lower price already.
Answer is no.
I defer to Senator Paul.
The Senate Committee on Health, Education, Labor, and Pensions will come to order. And let me begin by thanking all of our panelists for being here for what will be, I think, a very important discussion for tens of millions of families in this country. You know, as a nation, we often talk about family values and how much we love our children, but unfortunately, we have a funny way of showing that love. In America today, we have the highest rate of childhood poverty of almost any major country on earth. And we have, as we will be discussing today, a broken and dysfunctional child care system. It is no great secret that the psychologists tell us that the most important years of human intellectual and emotional development are 0 through 4. That is what the psychologists tell us. Yet there are very few people, I think, who will come to the conclusion in this country that we provide our youngest children with the kind of love and care and attention that they need. And that really is disgraceful. The young people are the future of America, and in many ways we have turned our backs on them. We are the richest country in the history of the world, and there is no excuse, if we got our priorities right, why we should not be providing the highest quality of childcare for the little ones and to ease problems for their parents. Again, I don't have to tell anybody who is here that in America today, the cost of childcare for a variety of reasons is outrageously high and unaffordable to millions and millions of working class and middle class families. In Vermont, which I think it's about the national average, it's about $15,000. Here in D.C., as your staff will tell you, if you have any kids who have staff, if you have any staff who have children, they will tell you, you know what child care is in D.C.? It's about $30,000 a year, which is very, very high. Imagine $30,000 a year if you got a 2-year-old. And how can a working class family, people make $50,000, $60,000, $70,000 a year, afford to spend $15,000 a year on child care or even more? And the result of that is that, according to a recent survey, 40% of parents in America have gone into debt due to the cost of child care, and nearly 30% have had to make unacceptable choices of paying for child care or paying their rent or mortgage. In other words, you want to have a kid in America and you're working class? Well, we're going to make you pay for that, boy. You're going to go deeply in debt. Thank you for having a child. Not exactly what I think we should be doing as a nation. All over, not only is the cost of child care outrageously high, for families in most parts of this country, it is very, very difficult to find a slot. And I will not surprise anybody on this committee, because you've all heard the story. People get pregnant, and the first thing they do is call up a child care center or a place trying to find a spot. And they're told, well, maybe, but in all likelihood, you'll be on a waiting list. And the other point that I would make is not only that childcare is terribly expensive, not only that is that there are not enough slots. If we appreciate the kids and we understand how important care is for the little kids, obviously the conclusion is you're going to respect the people who work with the children, who you can argue do some of the most important work in America, nurturing the little children. And yet we are paying in this country those workers outrageously low wages. We're paying them starvation wages. And we're talking about paying people $13, $14 an hour. And the result of that is tens of thousands of people are leaving the profession. They can make more working in McDonald's than they can nurturing our little children. And the last point that I would make is if you think this is just about the little children and you think it's about the parents, you're wrong. It's also about the economy, all right? Now, nobody has the exact numbers, but I have heard that there are at least many, many hundreds of thousands of people, mostly women, who would like to enter the workforce. They can't because they cannot find quality, affordable childcare. Now, we made progress in the American Rescue Plan. Finally, the United States Congress said, you know, we appreciate our children, we appreciate our workers, we appreciate our parents, we're going to do something about it. And we significantly increased funding for childcare. Not enough, but we made some progress. And right now, though, we are at a precipice where that funding may disappear. That funding kept over 200,000 childcare providers in business, sustained childcare for nearly 10 million kids, and prevented 1 million childcare workers from losing their jobs. That's the good news. The bad news is that if Congress does nothing, this funding will expire on September 30th of this year, making a very bad situation worse. We cannot afford to allow that to happen. We need to renew that vital funding. But let us be clear, that is not all we need to do. We need a vision for all those that the family values. We need a vision for the future which understands that every family in America has the right to high-quality, affordable child care, that child care workers deserve decent pay for the important work that they do, and that we must expand the number of child care programs available so that anybody in America can get the quality care they need. So I look forward to working with all of my colleagues on this committee to make that a reality. Let me begin the questioning. Let me start off with Mr. Grigorinski, and I don't have a lot of time, so please answer briefly. Mexico is not the most progressive state in the country. It's not the most conservative state in the country. You have kind of revolutionized the way you do child care in that state. How do the people in Mexico feel about it?
Thank you, Chairman Sanders.
Talking to the mic, please.
Thank you. They are thrilled. I traveled the state. I talked to families. I talked to providers. I talked to educators. Everybody feels more valued and respected.
So what the governor has done and what you have done is popular in the state. People feel good about it.
Absolutely.
All right, Ms. Hogan, let me ask you. You're an expert on children in this country. First thought, how do we compare in terms of our child care with other countries? And second of all, in your judgment, given the fact that psychologists tell us 0 through 4 is the most important years of intellectual and emotional development, how do we treat our kids in general?
Thank you for the question. I think it's really important to know that the U.S. does not stack up well compared to what other countries have chosen to do, given, interestingly, research and information that they base on what's happened in the U.S. They know from what we've done the promise that exists in early childhood education and learning, and they've taken that and made the investments that are necessary across childcare, of course, but also paid leave and the other ways in which we're able to invest in the supports for children and families that are needed.
Okay, Ms. Mormon, we've heard a lot of discussion today. You made one simple fact, which I think tells us all as much as we need to know. You mentioned that you are paying workers at your facility, which I gather is not a government-run, one-size-fit-all. It's a little small private operation that you have. What, 11 families, is that right?
Yes, sir.
Okay. You mentioned you pay workers in Virginia $12 an hour.
Yes, sir.
And I know that you do it. That's the best that you can do. You're struggling to stay in existence. I mean, just in general, and I applaud you for maintaining your facility and providing childcare. But would you agree that we have to, as a nation, do better then pay people less than what they make in McDonald's or almost any other profession out there?
Yes, sir, I would. As I mentioned in my testimony, I'm enrolled in the Virginia Child Care Subsidy Program, but I have vacant slots that I cannot fill because I need to hire an additional staff person. I recently interviewed, as I stated, the young lady, and I shared the pay, and she declined. So hiring an additional person would have given us the ability to care for more children and be more flexible with the hours. Currently, as it stands, if either of us, meaning my other staff person, if we are sick or have a family emergency, then I must either close my facility for that time period or reimburse parents for the day if they are unable to find alternate care for the day that was not a scheduled day in advance.
Thank you. Let me get back to Madam Secretary here. What have you been able to do to raise pay in New Mexico and attract more qualified workforce?
What we've been able to do is we raised everybody's wages $3 an hour who worked in childcare. Providers opted in if they wanted to do that. We've also set our childcare reimbursement rates at the true cost of care using the cost estimation model. Providers are able to attract and pay people now $16 an hour, $17 an hour, and we're valuing and respecting, again, families and educators. And families have more choice. Families now have more choice, both because we have family child care, we have faith-based, we have language immersion programs.
See, the idea of one size fits all is not what you're doing in New Mexico.
No. They're all private businesses, nonprofit, for-profit, faith-based. There's lots of options for families, and it's important that we invest in all of those options.
Ms. Hogan, if in Vermont it costs $15,000 a year, what impact does that have on the financial well-being of families? Can families afford, in many cases, middle-class, working-class families, afford childcare?
Vermont's actually doing really great work to address comprehensively early childhood education, but you know, the reality is that families can't, as we know, families cannot afford it. The problem is that policymakers ask parents to cover this cost of care out of their own pockets. And we ask educators to subsidize the cost through their own low wages. And that's because of the way the market is structured, it doesn't work because the benefits go so far beyond each individual and family.
All right, let me interrupt you and just ask you my last question here. Why is childcare so expensive?
It's a great question because it's something that every parent with kids in or looking for childcare asks. And the reality is that it does require a little bit of an understanding about the market. It is a labor-intensive market, and it should be. Like, this is about driving safety and consistency and quality. Programs regularly spend up to 85% of costs on personnel to have these in place. But it's important to remember, I think, that the goal is...
In other words, you don't have one worker for 30 or 40 kids.
No. And you have to have those in place in order for safety and for driving quality. And we can talk more about some of those pieces.
Okay. Thank you very much. Let me begin the questioning. Mrs. Russell-Tucker, you mentioned the importance of after-school and summer programs. And I think one of the things we all agree on is that we're going to have to do a lot of treatment, but on the other hand, we're going to have to give young people a lot of positive community-based activity. Can you talk a little bit about the impact that increased funding for summer and after-school programs has had in Connecticut?
Thank you, Senator. Really important and I appreciate that question because it's such an important piece of the work that we've been doing. Under our ARP ESSER funding, that we received $11 million for summer enrichment, and we immediately put that to work. And our state stepped up and added more funding for the subsequent summers, and so we're now up to $33 million of state investment around summer enrichment. We're able in that space. The first summer was to really try to get students back together, back with their peers, back in that environment, allowing them to work with sometimes behavior therapists in that space while they're having really good time with each other, right? So it is an enrichment which was so important. And so we've been able now, we've also evaluated the impact of that reimbursement. As I mentioned in my testimony, over 108,000 students were served that first summer. We're now into summer number 3. and we're evaluating it rigorously to make sure we know what's happening and so that we can make.
And let me
make it-
guess that you would like Congress to continue that kind of funding.
Continue,
Is that a good guess?
Exactly. Fund what works. Right, that's when we're thinking about sustainability. Same is true for our after-school program that we also receive funding to support.
We significantly expanded those programs in the American Rescue Plan.
Yes, absolutely. And so it's important that we are funding what works, and that's why I'm so proud that we're evaluating the impact of those investments.
Okay, Dr. Garcia, I want you to pick up on that. Again, we want to treat the millions of young people who are struggling, but we also want to challenge them. We want to bring them together. We want to have proactive activities. It sounds to me like in Tacoma, you are challenging young people. You're trying to provide job opportunities, among other things. Talk about the importance of treating young people with respect and allowing them to use their energies in productive ways.
Thank you, Senator. I think it's important that each community has the opportunity to define what respect, responsible, and safe looks like. And that's what our social emotional learning plans do. They bring student voice to that conversation, they bring staff voice to that conversation, and they bring family voice. Each of our plans is published, so Stanley...
And young people are involved in the development of those plans.
Absolutely, absolutely. And they define what it looks like in each location, right? Respect looks a little differently in a classroom than it does in a lunchroom, right? There's different settings. It looks different than in your neighborhood. And so we have to build community through a common language, and that's important. We bring respect, and what does that look in the after-school world? How do we hear their voice, and what are the activities that they want to participate in? So it's very much an intentional effort to bring community together to define that, but those common words are across all town.
And I'm gathering that the empowerment of young people, giving them a voice in the community, has a positive impact on mental health, among other things.
We bring voice in several ways, and we also hear from students. Students have asked me, they've said, Josh, stop asking us our opinions and bringing others to ask our opinions if the adults aren't going to do anything. And that's a really important message. So we bring voice through empathy interviews. We bring data around positive interactions. We have student voice at our board meetings. Students will vote with their feet, if you will. The increased activities and extracurricular activities, not what the adults want to offer, but what do they want to participate in. They've also told us they don't want to be engaged in the business model. They want to know the activity of that. Good. We survey their interests regularly.
Okay, let me ask Dr. Osofsky a question. You use the term indefinite uncertainty. What impact, you walk through the streets of Washington this morning, you breathe the air, which is a result of terrible fires in Canada. Young people worry about climate change. We've heard discussions, as Senator Kaine mentioned, his own school, gun violence in the school, kids worry about gun violence. Families all over the country are struggling economically, Louisiana, Vermont. What impact does all of that and more have in indefinite uncertainty about worrying what the future is going to look for these young people, whether there will be a decent future from an environmental point of view, from an economic point of view, from a violence-free point of view? What impact is that having on the lives of young people?
I really appreciate your asking that question, because this is something that I struggle with, and a lot of us struggle with as in the mental health world. What children need of all ages growing up is they need to have schedules. They need to have routines. They need to know what's expected. So, for example, having a schedule of knowing they get up in the morning and they go to school, and who's going to pick them up at school or where they're going to go and what their activity might be. And what happened, unfortunately, with the COVID pandemic is that changed continually. So one of the things that we recommended is, set a new schedule, have the children involved with setting the schedule so there's something predictable for them. But it went on for a very long time in that way. We also tried to support the parents, too, because parents didn't have a schedule either. Instead of getting up and if they went to work, going to work and doing whatever, they were having to balance that with educating their children virtually if they were fortunate to have the internet and the equipment that's needed to do that. And every day that changed as well for them. The other thing that's very important for the young people is their peers at every age. For the younger children, being able to play with them and get to know them. For the older children, we know that it gets more complicated in adolescence and that kind of thing, which, as I mentioned, contributes to some of the extensive use of social media. So it's very, very important now that schools are open again for there to be that kind of schedule and things that parents can count on and children can count on to be able to move forward. I also wanted to make a comment on the involvement of youth. We found that to be extremely helpful after there was so much destruction with Hurricane Katrina, that there were a lot of teenagers who were on the streets because there was nothing there for them to do with themselves. There were no activities. So we involved them with recovery. And the teachers who also didn't have classrooms in schools, they involved with recovery so that the teenagers, instead of being in trouble, were able to contribute in positive ways.
Okay, thank you very much. My time has long expired. Who's it, Senator Braun or Senator Cassidy? Senator Cassidy.
Dr. Ossowski, in some schools, they're limiting information sharing between parents and teachers, effectively.
Senate Committee on Health, Education, Labor, and Pensions will come to order. And we're delighted to welcome our panelists who we're going to hear from in a few minutes. But let me begin by telling everybody what they already know, and that is, it is no great secret that in America today we have a mental health crisis, and that crisis has been exacerbated by the horrific COVID pandemic, which we have experienced. And this is a crisis that has hit all of us, but I think especially the younger generation. In America today, 40% of parents report being either very or extremely worried that their child is struggling with anxiety or depression. According to a recent survey by the Centers for Disease Control, nearly 1 out of every 3 teenagers in America reported that the state of their mental health was poor. 2 out of every 5 teenagers felt persistently sad or hopeless. And tragically, 1 out of every 5 teenagers in our country have seriously considered suicide. How frightening is that? Tragically, suicide was the second leading cause of death for young people between the ages of 10 and 14, and it was the third leading cause of death among teenagers. All of us understand that the pandemic has had a huge and lasting impact on the mental health and well-being of our country and our young people. Let us never forget, and sometimes it's easy to forget, we remember the 1 million people who died during the pandemic, but over 200,000 children, often children of color, by the way, lost one or both of their parents to COVID, and think about the impact that that's had on their lives. Further, and I think we're going to hear more about this later, our kids have become less connected humanly to each other, and this is kind of a new phenomenon, and Dr. Murthy has written about this, and I'm sure we'll be speaking about it this morning. Instead of building trusting, healthy, and strong relationships with their friends, their teachers, their mentors, an increasing number of our kids are turning to their phones and social media to feel connected. And what type of impact does social media have on the mental health of our nation's youth? That's an issue that we have got to really explore at great length as a nation. According to a recent study, 32% of teen girls said that when they felt bad about their bodies, Instagram made them feel worse. More than 40% of Instagram users who reported feeling unattractive said the feeling began on Instagram. About 25% of teenagers who reported feeling not good enough, inadequate, said it started on Instagram, but we're not here to single out Instagram alone, certainly. And I'm sure that the same can be said about other social media platforms. And let's be clear, and something I think this committee in months ahead will get into. We are up against some of the best minds in the world who keep coming up with new ways to get teenagers addicted to their websites in order to sell them more products and make more money. And that's what we are going to have to address. But it's not just social media, as dangerous as that may be. Kids in Vermont, and I've been around to a lot of high schools, some community colleges in my state, but around this country as well, worry about the kind of future that awaits them. They wonder if their political leaders in this country and around the world will address climate change, or whether the world that they and their kids will grow up in will be increasingly unhealthy and uninhabitable. And I really do wonder, walking here today through the smog and the smoke that Washington, D.C. is experiencing right now, the horror in New York City. Yeah, it's a bad day, but you wonder what impact it has on the kids who wonder, is this the future for me? And what that does to them psychologically. Yesterday, on another issue, I had the occasion to meet with people who came to the Capitol who lost loved ones as a result of gun violence in schools. And I was stunned in Vermont, where kids worry. You know, when we were young, you went to school, it was a safe haven. Now they really wonder that some terrible thing might happen. And when we talk about the anxieties facing young people, we can't ignore economics. Everything being equal, if we don't get our act together, the young people will have a lower standard of living than their parents. And right now, some 60% of our people are struggling paycheck to paycheck. So all I would say is the pandemic has exacerbated a bad situation. It is there. As political leaders in this country, it's our job to address it. Senator Cassidy, the mic is yours.
Thank you, Thank you, Chair Sanders. I also thank our staff who've worked really hard to get this legislative vehicle together. I just acknowledge them. As ranking member of the committee, getting reauthorizations done on time in a bipartisan manner should be a top priority, and today's markup is an important step in accomplishing this goal. I thank Chair Sanders, who's noted his commitment to finishing reauthorizations in a timely manner with support from both Democrats and Republicans. And I look forward to more bipartisan reauthorization markups soon. Thanks to the rest of the committee, you guys all. We don't always agree, but it's our responsibility to put politics aside to make sure that important programs are properly evaluated and improved to benefit our fellow Americans. Today, we're considering several expiring reauthorizations related to public health that enhance treatment and research of serious diseases. Specifically, Senators Susan Collins and Mark Warner's NAPA Reauthorization Act extends the National Alzheimer's Project to 2035, supporting a strategic national plan to combat Alzheimer's and related dementias. We're also marking up Senator Collins and Ed Markey's Alzheimer's Accountability and Investment Act, requiring NIH scientists to submit an annual Alzheimer's research budget directly to Congress. Senator Collins is busy. We're also addressing Senators Collins and Dick Durbin supporting and improving rural EMS needs reauthorization, and I love this acronym, the SIREN Act, which ensures that rural EMS agencies are properly staffed and have the equipment they need to provide critical emergency care to Americans living in rural, underserved areas. We're considering Senators Tim Scott and Cory Booker's sickle cell disease and other heritable blood disorders Research, Surveillance, Prevention, and Treatment Act of 2023, expanding the number of clinicians who can treat sickle cell and improving coordination with other providers. As a physician who worked in a public hospital system for over 20 years, I can personally attest to the devastation that sickle cell can bring at an early age to those who are afflicted. Just making sure that we're fully employed, Senator Collins is working with Senator Shaheen, for a Special Diabetes Program Reauthorization Act of 2023, providing mandatory funding for the Special Diabetes Program and the Special Diabetes Program for Indians, $170 million for each program in fiscal years 2024 and 25. We mark up Senator Tammy Baldwin and Mark Wayne Mullins' animal drug and animal generic user fee amendments of 2023, ensuring that veterinarians, farmers and ranchers have access to new medicines to keep families and animals healthy and protect against outbreaks of disease. I want to highlight Senator Roger Marshall's policy on zootechnical food substances, which will be offered as an amendment today. This would streamline FDA's review of a new category of products that help farmers and ranchers make their operations safer and more efficient, including products to reduce the risk of foodborne pathogens like Salmonella and E. coli and increase production of milk, eggs, and meat. And as a physician, I would say these products are analogous to the nutritional supplements such as folate and easily absorbed iron for women who are pregnant. The policy gives the FDA similar flexibility for animal products that it has for supplements for humans. I thank Senators Collins, Marshall, Mullen, Tim Scott, Warner, Markey, Durbin, Booker, Baldwin, and Shaheen, who have spearheaded these bipartisan pieces of legislation. These reauthorizations are crucial to improve health care for Americans and for animals, which ultimately is for Americans. Ensuring that these and all reauthorizations are passed and signed into law before September 30th requires the full commitment of every member of this committee and continued leadership from our chair. And our work is cut out. But this markup shows that both sides of the aisle are committed to working together to get these reauthorizations completed. And today's bipartisan effort should be a model for how this committee functions going forward. And I hate to end on a downer note, though, but it appears, unfortunately, that a bipartisan effort going forward will not always be the case. Yesterday, the chair announced that next week, this committee will depart from its long tradition of bipartisanship to hold its first partisan markup since the Affordable Care Act of 2009. For what? For controversial legislation that will not pass Congress, it will not pass the Senate. For almost a decade and a half, this committee has fulfilled a commitment to work past partisanship, securing real solutions for American families. Breaking this tradition is beyond disappointing. It does not set the stage to complete the important work Americans depend upon us to complete. That said, I thank Chair Sanders for today's markup and all of you for your collaboration. I look forward to today's conversation on how to better these reauthorizations. Thank you. I yield.
Committee on Health, Education, Labor, and Pensions will come to order. This morning, we will be considering 6 bipartisan reauthorizations, and I'm pleased that we are voting on these bills today. And I just want to take a moment to thank my staff and Senator Cassidy's staff who put a whole lot of work into making these bills possible. First 2 bills we are considering today are S-133 and S-134, a reauthorization of the National Alzheimer's Project led by Senators Collins and Warner, and the Alzheimer's Accountability and Investment Act led by Senator Collins and Markey. Senators Collins, Markey, and Warner are all co-chairs of the Congressional Task Force on Alzheimer's Disease. These bills reauthorize the National Alzheimer's Project through 2035, expand the Associated Advisory Council, and require NIH to submit an annual professional judgment budget estimate for related initiatives directly to Congress. Alzheimer's, as we all know, is a terrible disease. An estimated 6.7 million Americans are living with Alzheimer's, and experts estimate that number to increase to nearly 13 million by 2050. I urge my colleagues to support these bills and thank my colleagues, particularly Senators Collins and Markey, for their bipartisan leadership on this issue. The next bill we will be considering today is S-265, the Supporting and Improving Rural EMS Needs Reauthorization Act. That's led by Senators Durbin and Collins. This bill extends a grant program for emergency medical services in rural areas through fiscal year 2028. EMS organizations across the country, as I trust anyone who lives in rural America knows, are in a state of crisis. Overall turnover among paramedics and EMTs ranges from 20 to 30% every year. This program makes sure that people who live in rural areas have the emergency medical staff, volunteers, and equipment they need to provide critical care for their communities. This bill also updates the program by making sure that EMS personnel are trained to care for individuals with mental health and substance use disorders during an emergency, and allowing the use of grant funds to acquire overdose reversal drugs and devices. The next bill we will be voting on today is the Animal Drug and Animal Generic Drug User Fee Amendments Act of 2023, and that's been introduced by Senators Baldwin and Mullen. This bill reauthorizes FDA's user fee programs for veterinary drugs that our nation's farmers and families need for their animals and their pets. We will also be taking a vote on a very good amendment from Senators Marshall and Baldwin that would allow the FDA to approve products that are necessary not just for animals, but for farmers and people as well. These food additives could, for example, reduce salmonella in chickens or encourage milk production in cows. This is a common-sense bipartisan proposal, and I urge my colleagues to support it. The next bill we are considering today is the Sickle Cell Disease and Other Heritable Blood Disorders Research, Surveillance, Prevention, and Treatment Act of 2023, led by Senators Tim Scott and Booker. This bill would extend the program to treat sickle cell disease and prevent and treat complications from sickle cell disease. Sickle cell disease is a common inherited blood disorder that can, in some people, cause chronic pain and other serious health problems. I strongly support extending and expanding this program to improve our efforts to treat this disease. Last but not least, the sixth bill we will be taking up today is S. 1855, the Special Diabetes Program Reauthorization Act of 2023, led by Senators Collins and Shaheen. This bill will increase funding for the Special Diabetics Program at NIH and the Indian Health Service to make sure that important work to cure, treat, and prevent type 1 diabetes will continue. I support these bills, and I believe they should be signed into law as soon as possible. Senator Cassidy, the mic is yours. Thank you. To be considering three very important pieces of legislation which in many senses has been around for a long time. The three bills that we will be considering are the Paycheck Fairness Act, which requires equal pay for equal work. As I think many people know, women in America make substantially less than men for doing the same work, and that's something that has been discussed for years and something that we intend to address today. The Healthy Families Act is the second bill that we will be dealing with, and that guarantees up to 7 paid sick days for every worker in America. As I think, again, many members know, the United States of America, the wealthiest country on earth, is the only major nation not to guarantee workers any paid sick days. So you have millions of workers who, when their kids get sick, their spouses get sick, cannot get guaranteed time off from work. And that, to me, is an outrage, and that's a bill we will be dealing with today. And the third bill that we will be dealing with is the Protecting the Right to Organize Act, the PRO Act. Workers in America have the constitutional right to assemble and form a union. We have that right, but the truth is, over the last many decades, corporate interests have done everything that they can to make it impossible for workers to exercise that right. And we will be dealing with that issue as well today. All of these issues come within the context of a nation today in which the gap between the people on top and everybody else is growing wider. We have more income and wealth inequality than we have ever had, more corporate concentration of ownership than we have ever had. And in the midst of all that, 60% of our people living paycheck to paycheck, millions struggling to pay the rent, put food on the table. The three bills that we are going to be working on today have the strong support of dozens and dozens and dozens of national organizations. Let me just read a few. These three bills are supported by the AFL-CIO, by AFG, by the American Federation of Teachers, the American Postal Workers Union, the CWA, the Economic Policy Institute, the Feminist Majority Foundation, Jobs with Justice, the NAACP, the National Education Association, the National Network to End Domestic Violence, National Urban League, Oxfam America, SEIU, and many, many, many others. So these are not radical ideas. They've been around for a long time.
Thank you, Chair Sanders. I'm about to speak as a ranking member, of course representing Republicans, but also trying to represent the kind of concern regarding committee process and my responsibility as a ranking member to make sure that it's completed. With that said, for almost a decade and a half, this committee has worked past partisanship to produce meaningful legislation. And we, on both sides, have set apart 20% of where we disagreed to focus on the 80% where we agreed. But this means that for every markup, there is an agreement between the chair and ranking member for that which is considered. And nobody got everything they wanted all the time, but we got key legislative victories, and in so doing, the Help Committee made lasting change. I will point out, this markup is different. This is the committee's first partisan markup since the Affordable Care Act in 2009. And abandoning a bipartisan approach, which has defined our committee and has made it so productive at addressing issues facing our fellow Americans, means that this legislation will not pass. And I'm saying that with no sense of victory. I'm just saying that it takes 60 votes to pass in the Senate. And whatever we produce will not get those 60 votes. And why? Because this is a deeply controversial and partisan set of bills that, again, will never be signed into law. Now, I'm the ranking member. We are all supposed to be concerned about the committee fulfilling its responsibilities. But we have 2 legislative days left before the July recess, and we don't have agreements in principle, nor agreements on key issues, or draft text for many important bipartisan programs that can matter a heck of a lot to both the Democrat and Republican members of this committee, and these programs are expiring in September. For example, we don't have an agreement on text for the Pandemic and All Hazards Preparedness Act reauthorization, which supports our nation's response to global pandemics. Negotiations are being held up because of drug policy demands that are completely outside the purview of PAPA. We don't have an agreed upon process for addressing the Support Act, which addresses our nation's opioid crisis. We don't have text or even basic agreement on funding levels for the reauthorization of community health centers or the National Health Center Service Corps to help troubling shortages in our nation's healthcare workforce. The chair had announced to Politico a few weeks ago that he's requesting roughly $131 billion for community health centers over 5 years. Current funding is $20 billion over 5. We don't have offsets. CBO has not scored this. If we're going to find offsets, we should have been working on this since January. But that said, all the staff time that has gone into this partisan markup is not being used for that. And the likelihood of successfully vetting and operationalizing policies to justify or pay for an over 5 times increase in funding, in addition to finding agreements on other reauthorizations that I mentioned, in the 16 days between now and what should be our deadline, which is the beginning of August recess, is, shall I say, slim. Instead, we're having a partisan hearing on labor bills, which will never be signed into law. Now, it's the majority's right to hold partisan hearings and markups that have a 0 chance of advancing beyond the markup. That's their prerogative, but it should not be at the expense of the bipartisan work that we're responsible to complete. By the way, there's other bipartisan things we could be working on. Expanding Pell Grants for short-term programs of at least 8 weeks. Reauthorizing the Workforce Investment and Opportunity Act to modernize and improve federal workforce programs. Fulfilling our constitutional duty to advise and consent President Biden on his nominations to fill vacancies at agencies like the NIH. Now, I hate to be disagreeable. I am so willing to work with the chair or anyone in the majority on programs, on policies, on laws that can get 60 votes in the Senate, to have a signing ceremony once the law is passed. But these bills are not they. One piece of legislation under consideration today is the Protecting the Right to Organize, or the PRO Act. It's not pro-worker, it's just pro-big union. And being pro-worker means defending the rights of all workers, including those who don't want to join a union. This PRO Act eliminates secret ballot elections, which is the gold standard to keep somebody from being put into a corner and intimidated until they vote the way the intimidator wishes them to vote. Secret ballot elections for unionization also protects workers from retaliation if they choose a different way. The PRO Act eliminates right to work in my home state and 25 other states, forcing workers, even if they don't want to unionize. By the way, if somebody wants to unionize, more power to them. I support their right to choose what's best for their career. But if the benefits of being in a union are so self-evident, there's no reason that workers have to be coerced and strong-armed to join. And they don't need the government to help coerce and strong-arm them. I will say this legislation is part of a disturbing trend by President Biden and congressional Democrats to erode a worker's individual rights. That is why I and the other Republican members of this committee introduced the Employees' Rights Act with our colleagues, Senators Tim Scott, Mitch McConnell, and John Thune. The Employer Rights Act upholds the rights of workers to choose what's best for their career, whether to join a union or not. It also protects the right to secret ballot elections, among other things. I join all colleagues to join in supporting this common sense legislation, protecting the rights of all Americans. This legislation is truly pro-worker. I repeat, the bills being offered today have no chance of becoming law. We have decided, this committee, the chair, has decided to prioritize the 20% of things we disagree on over the 80% of things where we do agree. We have real responsibilities that Americans are depending upon us to complete, and this committee should rise to this occasion. In closing, I'll say I'm sorry that my remarks are so disagreeable, but we got 16 legislative days left before the August recess. We reasonably have to complete these authorizations by then for them to be included in an end-of-the-year fiscal package, and we've not agreed upon basic frameworks and funding amounts. My hope is that the time lost preparing for this markup will be compensated for by greater productivity in the next 16 legislative days. I yield, and thank you.
And I'll turn on my microphone. This morning we will be considering the Pandemic and All Hazards Preparedness and, and Response Act, affectionately within the Beltway called the PAPA Act. Before we get started, let me take a moment to thank the staffs of Senators Casey, Romney, and Ranking Member Cassidy for working closely together to move this legislation forward. Our staffs have worked hard to ensure that this is a bipartisan bill that incorporates priorities for nearly all of our members on both sides of the aisle. As all of you know, and I don't think any of us will ever forget, we have lost over 1 million Americans from COVID, and this terrible pandemic has taken millions in almost every country on earth. And I think it is fair to say that while all of our public health people worked tirelessly and did everything they could to protect the American people, it would be an understatement to say that we were tragically unprepared to respond to that crisis. Months after the pandemic erupted, doctors and nurses lacked the masks, the gloves, the gowns, the equipment they needed to protect themselves and their patients. I think all of us will remember the pictures of nurses with plastic garbage bags in hospitals because they didn't have the proper equipment that they needed. We did not at that time have the tests that we needed to discover who had COVID and who did not. We did not have the infrastructure we needed to deal with the pandemic. All of us remember the overcrowded hospitals, the ICUs from one end of the country to the other that were really overwhelmed with patients. We did not have the vaccines at that time or the treatments that the American people throughout the world desperately needed. And as we learned at a hearing that we held in this committee, what the leading experts in the country are telling us is sadly, tragically, there is a real possibility that another pandemic, perhaps as deadly as COVID, perhaps worse, could occur in the near future. And clearly what our responsibility is to make sure that we are better prepared next time than we were last time. And that is basically what this legislation is about. This legislation will help us make sure that we have a capable workforce in place, not just nurses and doctors, but also public health workers, our disease detectives, who can figure out where an outbreak is happening and set up vaccination clinics, among many other things. This legislation will help make sure that we have accurate public health data to know who is getting sick and where they're getting sick. This legislation will help make sure that we have enough medical supplies, masks, gowns, gloves for our healthcare workers. And let us be clear, this legislation that we are marking up today will not only help us in our efforts to prepare and respond to the next pandemic, it will also help us respond to natural disasters as well as chemical, biological, radiological, and nuclear threats. Under this bill, we will improve data collection for infectious diseases and monitor new pathogens through wastewater surveillance. Under this bill, we will require drug manufacturers to report more information to the FDA about drug shortages so that the federal government can take action more quickly to respond to those shortages. This legislation will require drug manufacturers to notify FDA if there is an increase in demand that they will not be able to meet, which is what we saw with children's Tylenol this winter. I think you'll all probably recall your offices getting many calls about those issues. I'm also pleased that this bill will increase funding to expand the emergency medical services in rural areas. Further, this legislation directs HHS to work with the National Academies of Science, Engineering, and Medicine to study prizes, a transformative new way of paying for the development of prescription drugs. This study would take a serious look at how we can create new treatments and cures without the burdens of monopolies and high prices. As part of this agreement, Ranking Member Cassidy and I have agreed to send a letter to appropriators urging them to fund the price study. Let me conclude by saying I support this bill, and I believe it should be signed into law as soon as possible. Senator Cassidy, you are now recognized for your opening. All right, now we're moving on to S1664, the Healthy Families Act. There is no manager's amendment. Are there any members who wish to speak or offer an amendment to S1664?
Cassidy, number 2. Cassidy, number 2.
Senator Cassidy.
Yeah, so this would create exemptions for seasonal employees as covered individuals under the paid leave mandate in the Healthy Families Act. It's common for retailers and businesses to increase staffing to accommodate seasonal increase in business. The exemption for seasonal employees is specifically stated in state mandates passed by Maine, Rhode Island, and Nevada. And mandating a paid leave program for seasonal employees will force businesses to choose between hiring the necessary workers or risk closing during the busiest time of the year. Seasonal businesses are more likely to experience difficulty in predicting consumer demand and adjusting workforce, as each seasonal employer is less likely to have the capacity to manage the added complexities that come with a highly bureaucratic mandate. This amendment would give the flexibility to the small business that increase their staff during the busiest seasons, such as end of year, holidays, or summer, especially given that predicting the labor force needs is a challenge for seasonal employers. I ask my colleagues to support.
I oppose Senator Cassidy's amendment. This amendment would exempt more than 4 million seasonal employees in the United States from earning any paid sick time. Under the Healthy Families Act, employees can only begin using paid sick time after being employed by their employer after 60 calendar days. Seasonal employees are no less likely to face illness than their non-seasonal counterparts and should be able to utilize their earned sick time after the 60-day threshold like their colleagues. I urge a no vote on this amendment when it comes up for a vote. Further discussion or additional amendments? Senator Cassidy?
Amendment number 4.
Senator Cassidy.
Yeah, this is going to be an offer and withdrawal. It would replace the text of the Healthy Families Act with that of the Advancing Support for Working Families Act, legislation that I drafted with Senator Sinema, an actual bipartisan bill to help working families receive an advance on a child tax credit. She and I did lots of work on that, and it's my opportunity now to thank her. It's actually in the jurisdiction of the finance, and therefore I plan to withdraw based upon a point of order. But just to make the point that paid leave, especially for new parents, is an important issue that deserves consideration. The Advancing Support for Working Families Act provides families with flexibility and support without burdening small businesses or costing taxpayers. The issue of paid leave spans multiple committees' jurisdiction, and bipartisan solutions should be part of a bigger effort in coordination with those committees, including finance. But again, as I said, I shall withdraw this.
Okay, are there other amendments?
Yes, next would be Cassidy, number 5.
Senator Cassidy?
This would exempt companies that already offer paid leave policies that satisfy the 7-day requirements of the Healthy Families Act. And so between 2015 and 2022, this acknowledges that the percent of private industry workers with access to paid sick leave has increased to 77%. Particularly in times of economic recovery and high inflation, it's important to the employer that they not be hampered with additional costs and headaches associated with compliance of government mandates. And the market is clearly responding, so let's let the market work as opposed to giving one more feather on the back of that camel that we call the job creators. I ask my colleagues to support.
I oppose Senator Cassidy's amendment. This amendment seeks to exempt employers who already provide at least 7 paid sick days to workers. Here is the problem with this amendment. Under Senator Cassidy's amendment, employers would be allowed to fire workers for taking unscheduled sick days, which is precisely what we saw in the rail industry. Further, Senator Cassidy's amendment would also allow corporations to deny paid sick leave to parents who need to take care of a sick child. In my view, this would be unacceptable. I would urge a no vote on this amendment when the vote takes place. Further discussion, other amendments.
Cassidy, number 6. This would ensure that religious employers would not be mandated to provide sick leave for services in conflict with sincerely held religious beliefs. And we have to acknowledge that employers have a right to maintain religious freedom and should not be federally mandated otherwise. We uphold that principle in other areas of the law. This language was previously included and passed in legislation. It is a natural amendment here. The amendment would exempt religious employers from any requirement of the law that grants leave that would violate sincerely held religious beliefs and tenets. The amendment also affords the broadest applicability to employees of, quote, of such corporation, association, education, institution, or society, close quote. I ask my colleagues to support.
I oppose Ranking Member Cassidy's amendment. This amendment would exempt religious employers from having to provide paid sick leave. This amendment would remove sick leave protections for employers at religious institutions, including corporations, associations, and colleges. In my view, every employee in America deserves paid sick days regardless of where they work. I urge a no vote on this amendment when that vote takes place. Further discussion or amendments? Dr. Burke-Novely, thank you so much for being with us. Let me begin the questioning by picking up on a point you just made and you put in your written remarks as well. You said, and I quote, and goes without saying that everybody here wishes you the very best in your struggle with breast cancer.
Thank you.
You said, and I quote, every treatment I have received was supported by NIH-funded research, correct?
Correct.
Can you give us some idea, based on your expertise, about how much treatment for breast cancer costs in this country today? Somebody has breast cancer over a period of years, how much is it going to cost?
Chairman Sanders, that is a widely variable result. I truly could not give you an estimate because breast cancer is incredibly complicated and can range anything from, you know, a simple surgery to years and years and years of very extensive
Would
therapy.
I be wrong in saying that for some individuals it will cost hundreds of thousands of dollars for treatment?
I believe that is correct.
What do you say as a physician yourself, to somebody who is undergoing treatment for a drug or treatment that was developed by taxpayer dollars that they can't afford or are going to go deeply in debt to pay for? What does one say to a person to say, thank you for your tax dollars developing the drug, but I'm sorry you can't afford the treatment you need to stay alive? How does one respond to that person?
Yes, Chairman Sanders, I have to tell you that I have sat in clinic next to patients of my own who, for one reason or another, could not afford their treatment. It is a tragedy. I sincerely appreciate you championing the cause of affordable and accessible care for all Americans. And if confirmed, I will work with you to the fullest extent of my abilities to also ensure that that is the case.
Well, thank you for your thoughts. Let me be rather specific. If you are confirmed to be the next NIH director, will you commit to reinstating and expanding the reasonable pricing clause in NIH contracts? In other words, if the federal government puts money into the research and development of a drug, will you insist that the price that that drug is charged in America is not higher than it is charged in other countries around the world, given the fact that we paid for the research and development?
Chairman Sanders, I can say that I myself believe that the American people deserve a fair return on the investment that Congress has placed within the National Institutes of Health and the research that we do. And I will commit to working to make sure that the benefits of our research are affordable and available to all the American people. I cannot give further specifics at this time about the execution of that plan.
So you're not prepared to tell us that when taxpayers spend billions on a drug, they will not be asked to pay the highest prices in the world for what they paid for?
Chairman Sanders, I am more than prepared to say that I will do whatever I am able to make sure that affordable and accessible care is available for everyone who needs it.
Dr. Astellas and Pfizer are charging Americans with prostate cancer over $165,000 for Xtandi, while the exact same drug can be purchased in Japan for just $20,000. $165,000, $20,000 in Japan. This is a drug that was developed by NIH-funded scientists at UCLA. Do you think the price of Xtandi is reasonable? Should we be paying 8 times more for a drug that taxpayer dollars developed than the people in Japan?
Chairman Sanders, my focus is on making sure that the American people have access and availability and can afford the health care that can save lives, and that is what I will make a commitment to.
Right now, we pay by far the highest prices in the world for prescription drugs. The results are higher insurance premiums, higher hospital costs, and millions of people not able to get the drugs they desperately need. Will you commit to us that you will work to make sure that Americans do not pay higher prices for prescription drugs in this country than people around the world?
Chairman Sanders, it would be a great honor to be able to work with you to make sure that the American people have access to the care that they need to live long and healthy lives.
Okay, my time is up. Senator Cassidy. See, I knew, Senator Cassidy, that if we waited long enough, there would be an issue we would agree on. And obesity certainly is an epidemic. It's impacting diabetes and a host of other issues, and something this committee must and will deal with. There's an issue that we didn't touch upon today. I have raised my deep concerns that there are many millions of Americans who cannot afford the outrageous cost of prescription drugs in this country, and that is something that the NIH must deal with. But there's another issue that we didn't talk about, and that is that we look at the global situation. We look at developing countries and millions of people throughout the world who are struggling to feed their families. What we find is that many of the prescription drugs consumed are consumed in developed in the developed world, that poor people around the world cannot afford the medicines they need. Medicines, by the way, which may cost a few cents to produce. They don't get it, and they die or they suffer. Sorry. All right. Okay. Thanks. Last May, President Biden announced that the U.S. government would share some NIH-funded COVID patents with the World Health Organization to expand access in low and middle-income countries. If confirmed, will you build on this commitment and make sure that medicines developed with NIH dollars are accessible and affordable in low and middle-income countries? Will you ensure NIH-funded technology is shared with manufacturers in developing countries so that they can produce the medicines their people need at a price they can afford?
Senator, I can confirm that I share your concern. I share your passion for bringing life-giving care to not just the United States, but the world. And I will work with you on this issue.
All right. I would hope that you would appreciate that in some cases, these drugs cost a few pennies to manufacture, and yet they're not getting it to people for whom it might be life or death. That is something that you will pay attention to?
I will confirm that I will be very delighted to work with you on this issue. It is critically important.
Okay. Well, thank you very much, Dr. Bertinoli, for being with us today. That concludes our hearing. As a reminder, the committee will have a markup next Wednesday, the 25th, on this nominee and a few others. For any senators who wish to ask additional questions, questions for the record will be due tomorrow, Thursday, the 19th at 5 p.m. Committee stands adjourned.